Hey everyone, Bones and I, we're back again today and we're with our friend Carissa, the tooth freak. And we're here to learn about gum disease, what it looks like, and what you can do to prevent it. Come on Bones, let's go look at your choppers. All right, Carissa, so talk to us about gum disease. Now I know you can have healthy gums, and then you have gingivitis, and then you have periodontal disease, which actually sounds a little scary. Talk to us about what does that look like when you have healthy gums. Let's start there.
Yes. So a lot of times when we have healthy gums, what we normally see, we see nice, tight, pink gums, a little scalloping effect that shows that everything's hugging everything into place like we need it to be. Things are going to be nice and tight, so that way when you're flossing, it's really comfortable. A lot of times when we run into gingivitis, you start having more sensitive gums. So when you're brushing, when you're flossing, sometimes even just in your resting point, things feel like they're a little bit sensitive. You can feel a bad breath, or a lot of times you hear patients say there's some sweaters on their teeth. And that just means that there's more plaque, there's more biofilm, there's stuff going on underneath the gums that are causing the gums to be sick. Just your basic gingivitis. And plaque is the number one question that I get asked whenever I'm doing teeth cleanings. Is there a lot of plaque on my teeth? Why are they bleeding? And plaque is just an overall biofilm that we do have in our mouth, but it does build up whenever we're kind of neglecting our brushing, our flossing, and not really getting to the depths that we need to get to. Plaque also turns into tartar, the more common term that we hear. We like to call it calculus because it's hard. But tartar, it does develop on the teeth, and that's where you'll see more of the yellow around the teeth. You'll kind of feel like there's little rocks around the teeth. So it's just making sure that we can tackle what gingivitis is, get things to a healthier standpoint. And a lot of times you have to go to a dental office for us to clean all that off your teeth, and then we kind of work back to a healthier standpoint. Combating gingivitis is very simple, it's reversible, it's something that everyone happens to have in their life, different reasons, so it's totally cool that it happens. It's just when we neglect it, when we let things keep going further is where it advances to periodontal disease. Yes, it does sound super scary, but I'm here to tell you that it can be managed. It is perfectly fine to have it and to not feel terrible about it. You just gotta work up to how you're gonna manage it.
So say Bones is checking out his teeth in the mirror. What are a couple things that he can notice or that he may notice that say, oh my gosh, maybe I have gum disease? What does that look like?
Right. So like I had said before, when we have healthier gums, we see a nice coral pink. Sometimes we can have different color changes with it. That's just natural. But when you start noticing that gums are more bright red, they're more pink, they're more magenta, when they look bulbous, when they look swollen, when they almost look like they're growing over the teeth, those are some of the beginning signs of gingivitis. You don't have the nice scallop, they look more like swelling around the gums. Very sensitive to the touch, and then what I like to call undefined borders. So sometimes you can't even tell how it's going around. So there's some of the early signs to see when you have gum disease. Also, sometimes you can see white plaque on teeth, covering or in between. And that just means you really gotta work the toothbrush, you gotta work the floss, you have to make sure you're covering and cleaning everything efficiently, because if not, it goes underneath the gums like a little fingernail and things start advancing.
How important is flossing when you're trying to prevent gum disease?
Flossing is super important. From the Floss Boss, it is super important. I can't stress that enough, and I know it is very intimidating. A lot of patients don't like to floss, and I get it. It can be very time consuming. It definitely is intimidating to try to work angles of tooth floss, but there's different things that work well.
What is the best type of toothpaste that we want to look for when we're wanting to prevent gum disease specifically?
This is not a sponsored video for these products.
Yet!
We do recommend a lot of these products that we're mentioning. So a lot of toothpastes are really good out there. Some that I like to recommend are Crest Pro Health Advance. I also like to recommend Sensodyne products. They do have a sensitivity in gum. They have a periodontax that helps with bleeding. And those just consist of stannous fluoride. Another ingredient you can look for is cetylpyridinium chloride. Those are good antimicrobial bacteria properties that just help keep things in a nice clean environment. And also when you're looking at mouth rinses, you can find stuff that have peroxide in there. You'll see that same ingredient, cetylpyridinium chloride. And then you'll also see essential oils. Those are very good at just keeping things in a nice antimicrobial.
What about a good mouth rinse to prevent gum disease?
So a few mouth rinses that I like to recommend are Crest, Pro Health, that also have the peroxide in there. They're starting to come out with that a lot. You'll notice them on the bottles. Colgate also has a good peroxyl mouth rinse in there, and that's just a peroxide to help keep things antimicrobial. Another ingredient that you'll commonly see in mouth rinses is cetylpyridinium chloride, and that is also just another great antibacterial property. And if you want to go down a more therapeutic, natural route, you'll see a lot of ingredients that consist of essential oils like eucalyptus and hydrogen peroxide.
So peroxide is one of the most important ingredients that we want to look for?
Yes.
So how often do you need to go see your dentist?
So a lot of times we do recommend twice a year is a good basic general, because like hard water in the pipes, things are just going to build up over time. You can do your best brushing, flossing, but we do carry more components in our mouth, some more than others, so things are just going to build up. A lot of times it is necessary for a third cleaning, even a fourth cleaning, but it just depends on your insurance, what you can work with budget-wise, but a lot of offices will work with you and make sure that you can get the care that you need.
And like Carissa said, reach out to your dentist, because a lot of dental offices have different programs that you can enroll in where you can get cleanings and screenings throughout the year. Thank you so much for stopping by. We hope you like, subscribe, and don't forget to check out The Tooth Freak. Until next time, be well, my friends. Do it some more.
Downward strokes. Downward strokes.